If your leg starts to ache, cramp, burn, or feel heavy when you walk, but then eases after you stop and rest, it can be tempting to brush it off. You may tell yourself, "I'm just getting older," or "Maybe I overdid it," or "At least it goes away, so it can't be anything serious." But after 60, that kind of pattern is worth noticing. Not because it always means something dangerous, not because you should jump to conclusions, and certainly not because an online video can tell you what is happening in your body, but because leg pain that appears with walking and improves with rest can sometimes be a signal. It may be related to circulation, it may be related to the spine, it may come from joints, nerves, muscles, blood sugar problems, or even medication effects. The important thing is not to panic. The important thing is to stop dismissing a repeat pattern as just age. Many older adults describe this problem in very ordinary ways. A calf tightens halfway to the mailbox. A thigh starts aching in the grocery store. The legs feel heavy on the way back from a short walk. Stairs suddenly feel harder than they used to. Then, after a few minutes of standing still or sitting down, the discomfort fades, so life quietly adjusts around the symptom. You park closer. You avoid long aisles. You take fewer walks. You sit more often. You may not even call it pain at first. You may call it tired legs, stiffness, weakness, or simply slowing down. And because the discomfort improves with rest, it is easy to believe it is harmless. But that is exactly why this symptom can be confusing. When leg pain comes on during walking and eases after stopping, one possibility doctors may consider is something called claudication. Claudication is a word used for muscle discomfort that happens when a muscle is working but may not be getting enough blood flow for the work it is trying to do in the legs. Claudication is often discussed in connection with peripheral artery disease, or PAD. Peripheral artery disease happens when the arteries that carry blood to the legs become narrowed. When you are sitting still, your leg muscles do not need much extra oxygen. But when you walk, climb stairs, or go uphill, those muscles need more blood. If the blood vessels cannot increase that flow enough, discomfort may appear. That discomfort is not always sharp. It may feel like cramping, aching, burning, tightness, heaviness, fatigue, or weakness. Some people feel it in the calf. Others feel it in the thigh, hip, buttock, or foot. The location can vary depending on where the blood flow is limited. Then, when you stop walking, the muscles do not need as much oxygen. The demand drops. After a short rest, the discomfort may ease. That is one reason rest can make it better. And that is also why the symptom can be misleading. The pain disappears, so the person assumes the problem disappeared too. But sometimes rest is not proof that nothing is wrong. Sometimes it only means the muscles are no longer asking for extra blood. Now, this does not mean every person with walking-related leg pain has PAD. That would be too simple, and it would not be responsible. Leg pain after 60 can have many causes, but the pattern matters. A circulation-related pattern often shows up with activity, improves with rest, and may return when the person starts walking again. It may happen after a fairly predictable distance. For example, you may notice that your calf begins to tighten after one block, or your leg starts aching after 5 minutes, or stairs bring on the discomfort faster than flat ground. Those details are useful. They give your doctor something concrete to evaluate. Age itself can raise the risk of circulation problems, but age is not the only factor. Smoking, diabetes, high blood pressure, high cholesterol, and a history of artery disease can all make circulation issues more likely. People with diabetes or prediabetes should be especially aware because blood sugar problems can affect both blood vessels and nerves. That combination can make leg symptoms harder to interpret. A person may have blood flow problems, nerve symptoms, joint pain, or more than one issue at the same time. This is why it helps to slow down and look at the full picture instead of guessing. One major condition that can mimic circulation-related leg pain is spinal stenosis. Spinal stenosis means there is narrowing in part of the spine. When this happens in the lower back, it can put pressure on nerves that travel into the legs. That pressure may cause pain, heaviness, cramping, numbness, tingling, or weakness when standing or walking. But there is often an important clue. Some people with spine-related leg symptoms feel better when they sit down or lean forward, such as leaning over a shopping cart. That forward bent position may reduce pressure on the nerves. So a person may say, "I can walk farther when I'm pushing a cart, but standing upright makes my legs hurt." That does not prove the problem is the spine, but it is the kind of detail that is worth telling a healthcare professional. Joint problems can also cause walking pain. Hip arthritis, knee arthritis, foot problems, tendon issues, and old injuries can all affect how far someone can walk. Joint-related pain may be more connected to a specific joint. It may come with stiffness after sitting, swelling, grinding, or pain around the hip, knee, ankle, or foot. Nerve problems can also play a role. Neuropathy, which is more common in people with diabetes, may cause burning, tingling, numbness, or strange sensations in the feet and legs. Sometimes nerve symptoms are present even at rest or at night, not only during walking. Muscle strain, low conditioning, changes in balance, or reduced activity can also contribute. And in some cases, medication changes may be part of the conversation. Certain medicines can be associated with muscle symptoms in some people. That does not mean you should stop a medication on your own. It means that if new muscle pain began after a new prescription or a dose change, it is worth asking your doctor or a pharmacist about it. The safest way to think about this is simple. Leg pain when walking is not a diagnosis. It is information. Where it happens is information. How quickly it starts is information. Whether it improves with standing, sitting, or leaning forward is information. Whether one leg is worse than the other is information. Whether it is getting better, worse, or staying the same is information, and that information can help your healthcare provider decide what to look for. So what should you pay attention to? Notice if the discomfort appears when you walk and improves when you stop. Notice if it returns when you start walking again. Notice whether it happens after about the same distance. Notice whether hills or stairs bring it on more quickly. Notice whether the pain is in the calf, thigh, hip, buttock, foot, or around a joint. Also notice changes in the feet and legs. If one foot feels colder than the other, if the skin changes color, if the skin becomes shiny, if hair on the lower legs seems to be disappearing, or if sores on the feet or toes are slow to heal, those are details to take seriously. Especially for people with diabetes or known circulation problems, pain at rest is another important signal. If pain begins happening even when you are not walking, especially in the foot or toes, that deserves medical attention. There are also symptoms that should not be treated as a routine ache. Sudden severe leg pain. A leg or foot that becomes cold, pale, blue, weak, or numb, or a wound that is not healing should be evaluated promptly. And if leg symptoms happen along with chest pain, shortness of breath, sudden weakness on one side, facial drooping, trouble speaking, or sudden confusion, that is an urgent medical situation. For many people, though, the situation is not sudden. It is gradual. It shows up in small ways. A shorter walk, more frequent stops, a little less confidence, a habit of avoiding places that require walking. That is when it helps to prepare for a clear conversation with your doctor. Instead of saying only, "My legs hurt," try to describe the pattern. You might say, "My right calf starts cramping after about 5 minutes of walking, and it improves after I rest." Or, "My legs feel heavy when I stand and walk, but I feel better when I sit down." Or, "I can get through the grocery store, but I have to stop several times now, and that is new for me." Those sentences may sound simple, but they are useful. They help your doctor understand whether the issue might involve circulation, nerves, joints, the spine, medications, or something else. A clinician may check pulses in your feet and legs. They may ask about smoking, diabetes, blood pressure, cholesterol, heart disease, and past medical history. They may examine your back, hips, knees, feet, skin, nerves, and circulation. In some cases, they may discuss a test called an ankle brachial index or ABI. This is a non-invasive test that compares blood pressure at the ankle with blood pressure in the arm. It can help evaluate possible circulation problems in the legs. Not everyone with leg pain needs this test, but if the walking and rest pattern is present, it is reasonable to ask your doctor what kind of evaluation makes sense. Now, while you are paying attention to this symptom, there are some safe, practical habits that can support your health without pretending to be a cure. First, do not stop moving out of fear unless a healthcare professional has told you to limit activity. Movement matters for circulation, blood sugar, balance, muscle strength, and independence. For people who are diagnosed with certain circulation problems, structured walking programs may sometimes be part of care, but the right level of activity depends on the person, especially if symptoms are new, worsening, or severe. Second, track your symptoms. For a week or two, if the symptoms are not urgent, write down how far you can walk before discomfort starts. Note where you feel it. Note what makes it better. Standing still? Sitting down? Leaning forward? Also note whether one leg is worse than the other. This is not self-diagnosis. It is preparation. Third, be honest about risk factors. If you smoke, quitting is one of the most important steps for blood vessel health. If you have diabetes, high blood pressure, or high cholesterol, keeping up with medical care matters. If you have not had a recent checkup, recurring walking pain may be a good reason to schedule one. Fourth, look at your feet. This is especially important if you have diabetes or circulation concerns. Check for cuts, blisters, sores, color changes, or areas that are not healing. Wear supportive shoes. Do not ignore wounds on the feet or toes. Fifth, review your medications and supplements with a qualified professional. Bring a full list of what you take, including prescriptions, over-the-counter medicines, vitamins, and supplements. If leg pain started after a medication change, mention the timing. But do not stop cholesterol medicine, blood pressure medicine, diabetes medicine, blood thinners, or any prescription without medical guidance. That point matters because many people look for a simple answer. Some blame every new symptom on medication. Others reach for supplements that claim to improve circulation or clean out arteries. But walking leg pain is not something to treat with guesses. No supplement should be presented as a guaranteed fix for this symptom. And no video can decide whether a medication is right or wrong for you. That belongs in a conversation with a clinician or pharmacist who knows your medical history. The real goal is not to be afraid of walking. It is to understand what your body is telling you. Walking is more than exercise after 60. It is independence. It is grocery shopping. It is visiting family. It is getting outside. It is balance, confidence, and quality of life. So when leg pain begins changing how you live, it deserves attention. If you are avoiding walks because your leg hurts, that matters. If you are stopping more often than before, that matters. If you are choosing not to go places because you worry about your legs, that matters too. Not because it always points to something serious, but because it is affecting your life, and because it may be a clue. The main lesson is this: pain that appears with walking and improves with rest should not be automatically dismissed as normal aging. It may be linked to blood flow. It may be connected to the spine. It may come from joints, nerves, muscles, diabetes, medications, or a combination of factors. Only a qualified healthcare professional can help sort that out, but you can do something important before that visit. You can notice the pattern. You can track the distance. You can describe the feeling. You can pay attention to what makes it better. And you can ask the right questions. After 60, good health is not about fearing every symptom. It is about listening carefully when your body repeats the same message. So if your leg hurts when you walk, and rest makes it better, do not panic. But do not ignore it either. Sometimes the pain that fades after a few minutes is still worth a conversation. And sometimes that conversation can help protect your mobility, your confidence, and your independence. If this explanation helped you understand your body a little more clearly, subscribe for more calm, practical videos about health after 60, circulation, blood sugar, sleep, memory, and the everyday signals that are worth paying attention to.